have a lot of my people who are, RIC people. I have Dr. Mukesh Roy just walked in. Poor guy was caught in traffic. I have Bragesh Patel is here. Come on, man. The man behind the scenes. He does all the work. I have Bragesh Patel is here. Bragesh? Oh, okay. Come on. I have Puneet, who's a national for RIC. And let me give you a very funny, interesting story. Puneet is what I call a political pundit. He's a junkie. He reads those polls, he figures out what is going on, who's doing what. The first time he came and we were sitting down having breakfast, and he says, "This lady has it. She's going to win it." Okay? So, I have to say, Puneet, thank you.
I'm his right hand.
Well, Dr. RIC, that's a real pleasure to have you, so let me take the floor for you.
Yes, I'm one of the directors of the Association of American Physicians and Surgeons, which I realize is a mouthful, but it's been in existence since 1943, and we just believe in the practice of private medicine, meaning the transaction between a physician and a patient ought to be a private matter, and that the state really shouldn't get involved, because the state can start to do things that we're not really pleased with when that happens, and bad things can happen. In fact, the AAPS was against the beginning of Medicare and Medicaid, and I realize that that is a very controversial thought now. It's a very popular program, but think about it. Those programs are going bankrupt, and things are being paid for, and there's fraud and abuse, and is it possible that there's a better way to provide health care than to have a giant government program? Well, Obamacare is really bad, and that is going to bankrupt a lot of the physicians, and a lot of them are going to quit. I know about a third have already said they're going to quit medicine if Obamacare really gets fully implemented, and it's going to be a terrible thing. Hospitals are closing, and a lot because of all the things that government have done. There's EMTALA, there's all the different restrictions that are placed on hospitals that have made it almost impossible to stay solvent, and so they close. Anyway, Anna Little is different, and she's part of this huge wave that's going across America that is very, very exciting, and I think people are starting to get it. People are starting to get out their constitutions and read them and find out that, oh, we've been not really following it as much as we have promised an oath to do when we have taken office. So Anna Little is the kind of person that we need in Congress, and therefore the AAPS has made a PAC check that we'd like to present to you to bring you across the finish line. And we're all very excited that that's what's going to happen on November 2nd.
Thank you.
So it's my pleasure now to introduce to you our Senate Minority Leader, Senator Tom Kane, Jr.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. It's an honor to serve with you when we served together in the Assembly. Thank you for your leadership of this county. Doing an extraordinary job and a wonderful, wonderful friend. Thank you, Sam. Arthur, thank you for pulling this event together. And the seeds of this event started because you met Anna at the event for the next governor of South Carolina, right? That's where this started, because of the impression that Anna made on you then. And it's the same impression that Anna makes on people in Monmouth County who knew her so well as in Middletown when we were running around the Middletown Day that day, shaking hands, meeting people, doing things together. That's the type of impression that Anna has on everybody. It's the energy, it's the optimism, and this is a story that I think is going to be once told and then twice told, which is an energetic candidate who talks about solutions, who talks about accountability, who talks about liberty, and talks about making sure that government serves the people rather than its own self-interest. We heard that once from a candidate that wasn't supposed to win Middlesex County, right? Last year in Chris Christie. Yeah. All right? We are going to hear the exact same story this year about the next congressman from the 6th Congressional District, because there is no greater contrast, probably across this nation, than this election district. A congressman who said it wasn't Obama's health care bill. It wasn't Nancy Pelosi's health care bill. It was my health care bill. That's what Frank Pallone told the people of the 6th Congressional District. What are the results in New Jersey? They will say, it's our pleasure to introduce to the country, Congresswoman Anna Little.
All right.
My goodness, ladies and gentlemen, what a speech that was. And, you know, I have a lot of thank yous, and I'm going to begin with that. The first thing I want to do is I want to thank Arthur Kapoor for putting this together. He's an amazing friend. You know, it's amazing sometimes when you meet someone and in such a short period of time you connect. And I've connected with Arthur. I believe he is showing how he's connected with me, and we're going to work very closely together. Everything that we talk about doing here, I'm here to tell you, will be done. I really think we're part of making history here in a very special way. We are.
Let the Democrats not take it for granted that this vote is theirs. This is our time of fiscal conservatism to win. So with that, ladies and gentlemen, thank you so much.
I'm a physician, I'm a mother, I'm an American, and I believe in Anna Little. I believe that Anna Little is the right type of person that we need in Congress. I am the president-elect of the Association of American Physicians and Surgeons. We believe that the government ought to have a minimal role in healthcare, and that is why we like Anna Little. My husband and I started a free clinic where we can take care of the poor much more efficiently than the government can, and we can do it for 1/10 of the price. I know many physicians who are just getting ready to quit because of this huge government legislation that was passed. So Anna Little is the type of person who has agreed to work for the repeal and the defunding of this horrible healthcare law that President Obama and the current administration has endorsed and passed.